Hello guys, I hope you are. Today we're going to be briefly going through statins, and I wanted to primarily go through important monitoring points when it comes to statins. So with statins, we've already been through the fact that you need to monitor CK levels, creatine kinase levels, and ALT, AST levels. So an important consideration is what's the point of measuring baseline creatine kinase levels? So the point is, if the patient has persistent muscle pain symptoms, so pain, tenderness, weakness, you need to see that are these muscle breakdown issues due to the statin or not, right? Obviously, you would not measure creatine kinase levels after strenuous exercise or after, let's say, weightlifting in the gym, because you're going to have muscle breakdown already. So you don't want to confuse, you don't have any confusions with that. Now, you can also consider TSH levels in those that have hypothyroidism or hyperthyroidism. Now, before you initiate certain statins, you will need to treat the hypothyroidism before initiating the statin. And that is also a very, very, very crucial point. So manage hypothyroidism adequately before initiating a statin. This is very, very important. Now, you may be thinking, what's the link of thyroid levels to statins? And it's important because the body is interlinked. If you're going to have issues with your liver, or if you're going to have issues with your thyroid levels, that will inherently affect other systems in place, and it will affect the way the statins will work also, right? So manage hypothyroidism before initiating a statin. And this is a very, very important point to understand when studying. Now, obviously, what would you counsel the patient on? You need to tell the patient that if you have any unexplained muscle pain, then you need to report it to a doctor, as that could be a sign of rhabdomyolysis. Now, what is rhabdomyolysis? Lysis is a breakdown. So rhabdomyolysis is a muscle breakdown. And muscle breakdown or rhabdomyolysis presents as pain, tenderness, etc. Okay? So we've talked about creatine kinase, we've talked about ALT, ASTs. Also, we need to not forget that statins can cause hyperglycemia. So they can increase glucose levels. So you may be thinking as a student, our teacher, how is it that we use statins in diabetic patients if it can also technically worsen diabetes or cause hyperglycemia? Now, the simple response to that is, according to research, the vascular benefits or the benefit of statins outweighs the risk of causing diabetes. This is what the research says. So that's the reason why we may still be able to use statins in diabetic patients. Now, we also need to know the doses of statins, what is regarded as high intensity, what is regarded as medium intensity, low intensity, etc. Now, with statins, there is a very, very crucial MHRA warning we need to know. That is reports of myasthenia gravis in September 2023. So in September 2023, there was a MHRA warning in regards to myasthenia gravis. So there have been a very small number of reports of a new onset or exacerbation of pre-existing myasthenia gravis. Myasthenia gravis is simply a neuromuscular transmission issue. And that's basically what's important. So seek immediate medical attention if they develop severe breathing or swelling problems whilst taking atorvastatin. So healthcare professionals are advised to refer patients who present with suspected new onset myasthenia gravis symptoms after starting a statin to a neurologist. The statin may need to be discontinued if its risks outweigh the benefits. So an important point is, with any medication, you need to assess the risk to benefit. If the benefit of initiating the medication outweighs the risk, then obviously, logically speaking, it makes sense. As Gphc standard 1 says for pharmacy professionals, patient-centered care is the most important thing when it comes to even answering an exam. Is this for the benefit of the patient? You doing this Is this for your own benefit? Are you implementing your own bias? Are you trying to help the patient? Are you trying to improve their health? These are all things that you must consider before answering question in the Gphc exam. And once again, guys, thank you so much for tuning in, and good luck.